let's dive into the genetic basis of cystic fibrosis. Cystic fibrosis is a genetic disorder that primarily affects the lungs, but can also impact other organs like the pancreas, liver, and intestines. The root cause of this condition can be traced back to mutations in a specific gene called the CFTR gene. Now, the CFTR gene is responsible for producing a protein known as the cystic fibrosis transmembrane conductance regulator. This protein plays a crucial role in regulating the movement of chloride ions in and out of cells, which in turn helps control the balance of salt and water in our bodies. When there is a mutation in the CFTR gene, the production of the CFTR protein is either disrupted or altered. This means that the protein may not function properly or even be produced at all. As a result, the balance between salt and water in the body is thrown off, leading to the development of cystic fibrosis symptoms. So, to summarize, the genetic basis of cystic fibrosis lies in mutations in the CFTR gene. These mutations lead to problems with the CFTR protein, and ultimately, the symptoms associated with this disorder. Now that we have a better understanding of the genetic basis of cystic fibrosis, let's take a closer look at the pathophysiology of the condition, specifically the abnormal production and accumulation of thick, sticky mucus in the lungs and other organs. So as we discussed earlier, the CFTR protein plays a key role in regulating the balance of salt and water in our bodies. When this protein is not functioning properly due to a mutation in the CFTR gene, the balance between salt and water is disrupted. This leads to the production of thicker and stickier mucus than normal. Now, under normal circumstances, mucus is essential for trapping and clearing out bacteria, dust, and other particles from our respiratory system. However, when the mucus becomes too thick and sticky, it can cause several problems. In the lungs, this thick mucus can clog the airways and make it difficult for air to flow in and out. This can lead to breathing difficulties, wheezing, and persistent coughing. Moreover, the accumulation of mucus in the lungs creates a perfect environment for bacteria to thrive, which can result in frequent respiratory infections and inflammation. Over time, this chronic inflammation and infection can cause irreversible damage to the lungs, leading to a decline in lung function, and in severe cases, respiratory failure. The thick, sticky mucus can also affect other organs, such as the pancreas, by blocking the ducts that release digestive enzymes. This can result in poor digestion, malabsorption of nutrients, and ultimately nutritional deficiencies. In summary, the pathophysiology of cystic fibrosis involves the production and accumulation of abnormal, thick, and sticky mucus in the lungs and other organs. This leads to a range of complications, including breathing difficulties, frequent infections, inflammation, and damage to the affected organs. Moving on, let's discuss the various diagnostic methods used to identify cystic fibrosis. Early diagnosis is crucial for managing this condition and preventing complications. There are several methods for detecting cystic fibrosis, including newborn screening, sweat tests, and genetic testing. First, let's talk about newborn screening. Many countries have implemented newborn screening programs for cystic fibrosis as part of their routine health checks. This involves taking a small blood sample from the baby's heel within the first few days of life. The blood sample is then tested for elevated levels of a specific enzyme called immunoreactive trypsinogen, IRT. High levels of IRT may indicate the presence of cystic fibrosis, but further tests are needed to confirm the diagnosis. Next, we have the sweat test. This is the most common diagnostic test for cystic fibrosis. The test measures the amount of chloride in a person's sweat, which is typically higher in individuals with cystic fibrosis due to the malfunctioning CFTR protein. During the test, a small amount of sweat is collected from the skin, usually from the arm or leg, and then analyzed in a laboratory. If the chloride levels are above a certain threshold, it indicates that the person may have cystic fibrosis. Finally, genetic testing can be used to confirm a cystic fibrosis diagnosis or identify carriers of the mutated CFTR gene. This test involves taking a blood or saliva sample and analyzing it for specific CFTR gene mutations. Genetic testing can be particularly helpful for couples planning a family, as it can determine whether they are carriers of the CFTR gene mutation and at risk of having a child with cystic fibrosis. In summary, there are several diagnostic methods for identifying cystic fibrosis, including newborn screening, sweat tests, and genetic testing. Each of these methods plays a crucial role in the early detection and management of this genetic disorder. Now that we have covered the diagnostic methods for cystic fibrosis, let's explore the current treatments and management strategies for this condition. While there is no cure for cystic fibrosis, various treatments aim to manage symptoms, slow the progression of the disease, and improve the quality of life for patients. First, let's talk about medications. There are several types of medications used to manage cystic fibrosis symptoms. Some medications target the underlying cause of the disease by improving the function of the defective CFTR protein. Others aim to thin the mucus, making it easier to clear from the lungs. Additionally, antibiotics are often prescribed to treat or prevent infections, while anti-inflammatory drugs help reduce inflammation. Airway clearance techniques are another important aspect of cystic fibrosis management. These techniques help patients clear the thick, sticky mucus from their lungs, making it easier to breathe. Some common airway clearance techniques include chest physiotherapy, which involves manually patting or vibrating the chest to loosen mucus, and using devices like high-frequency chest wall oscillation vests or positive expiratory pressure devices. Maintaining good nutrition is also crucial for individuals with cystic fibrosis, as they often struggle with malabsorption of nutrients due to pancreatic insufficiency. A dietitian may recommend a high-calorie, high-fat diet, along with vitamin and enzyme supplements to ensure adequate nutrition. In severe cases of cystic fibrosis, lung transplantation may be considered when lung function has declined significantly and other treatments are no longer effective. While a lung transplant can significantly improve a patient's quality of life, it is a major surgery with potential risks and complications. To summarize, the current treatments and management strategies for cystic fibrosis include medications, airway clearance techniques, proper nutrition, and in severe cases, lung transplantation. These approaches aim to manage symptoms, slow disease progression, and improve the overall quality of life for those living with cystic fibrosis. Lastly, let's analyze the impact of cystic fibrosis on a patient's quality of life and discuss potential complications that can arise from this condition. The thick, sticky mucus associated with cystic fibrosis can cause various complications, which can significantly impact a patient's daily life. One of the main complications is frequent respiratory infections, as the mucus buildup in the lungs creates an ideal environment for bacteria to thrive. These infections can lead to inflammation, lung damage, and in severe cases, respiratory failure. As a result, people with cystic fibrosis may experience persistent coughing, wheezing, and shortness of breath, which can limit their physical activities and overall quality of life. Nutritional deficiencies are another common complication, as the thick mucus can block the release of digestive enzymes from the pancreas, leading to malabsorption of nutrients. This can cause growth delays in children, weight loss, and weakened bones. To manage this issue, patients often need to follow a strict diet plan and take enzyme supplements to maintain proper nutrition. Fertility issues can also arise due to cystic fibrosis, particularly in men. The majority of men with cystic fibrosis are infertile due to a blocked or absent vas deferens, the tube that carries sperm from the testicles to the urethra. Women with cystic fibrosis may also experience fertility challenges due to thick cervical mucus, which can make it difficult for sperm to reach the egg. The ongoing management of cystic fibrosis, including medications, airway clearance techniques, and frequent medical appointments, can also be time-consuming and emotionally draining for both the patients and their families. In summary, cystic fibrosis can have a significant impact on a patient's quality of life, with potential complications such as respiratory infections, nutritional deficiencies, and fertility issues. The daily management of the condition can be challenging, but with proper care and support, patients can still lead fulfilling lives.